Do you have carpal tunnel syndrome and you're looking for less invasive ways to treat either physical therapy is not working or you're preferring to not do surgery? Let's talk about nerve hydrodissection and how we would approach this case. So, nerve hydrodissections are a procedure where we go in specifically with a needle and a fluid and under ultrasound guidance, and we can basically separate that nerve away from the surrounding tissues using fluid. So, instead of a knife or anything like that, we're using fluid to gently separate those tissues apart. So carpal tunnel syndrome is a syndrome where that nerve in the wrist here gets compressed. There's a bunch of tendons. So if we see on the screen here, we have a bunch of tendons around here, and then we have our nerve right there in the top and center. And so when this gets irritated, that nerve swells, and that can cause numbness and tingling in these three fingers right here. It also can cause weakness with grip strength and can obviously be very bothersome, especially if it's your dominant hand, things like that. So what we would do is essentially go in to this carpal tunnel right here and inject underneath and above that nerve and physically separate that nerve away from the surrounding tissue. So that's going to do two things. One, that's going to mechanically decompress that nerve without knives or scalpels. And then also the solution that we use is going to calm that nerve down and help the nerve heal and reduce the swelling. So we're making the space that nerve's living in bigger, and then we're also making the nerve a little bit smaller by reducing that swelling. And the results that we see pretty quickly, sometimes if it's more acute, we can see that numbness and tingling go away pretty quick. And then over the course of months, as that PRP or injection solution is in there helping that nerve heal, we can start to see more long-term resolution of that. And again, this is much less invasive than a carpal tunnel release or surgery, and sometimes we can get quicker effects or benefits and improvements than physical therapy. So if this is something you've been struggling with and you want to reach out, want to know if you're a candidate, if we can help you, feel free to call the practice. We can do a discovery call, talk about your case, and see if this might be right for you.